Hi, my name's Carrie. I'm not a doctor, I'm not a nurse. This video isn't a diagnosis for anyone. This is me just telling you my personal experience with different health issues and how I help myself deal with it. I've wrote down a few notes just in case you see me looking down this way. It's just so that I don't forget anything. So basically, one of my health problems is I suffer with a disease called vulvodynia. A lot of people out there probably don't know what vulvodynia is. Vulvodynia is basically chronic pain in the vulva area. It can be the full area down below that suffers. It can be the inside as well. Vulvodynia can also cause different other health issues as well, and it's a really horrible thing to live with. It's very hard to control. Some doctors say it's not curable. You basically just have to do things, take medication in order to try and reduce the amount of flare-ups that you get. At first I was constantly treated for urine infections. This began when I was 15, but most of the time the urine infections, it wasn't an actual infection, even although they were treating me for it. I was admitted into hospital a number of times, and it was for the same thing. They just kept, they tested my liver, they tested my kidneys. I had a bladder operation. I had another operation. So the bladder operation was to stretch my bladder, and then I had a second operation to stretch the entrance of the bladder. I knew myself it wasn't my actual bladder that was causing it. I knew there was something not right, and I even knew that from when I was 15. I've been on probably every antibiotic that's out there. I've been on nearly every penicillin. I've had creams, I've had pessaries, I've had biopsies. I've had different suppositories, various natural remedies. I've had acupuncture. I've also been through speaking to a lot of different clinics for it as well. One of the clinics actually deals with anxiety and depression. I do suffer for them as well, and I would say that part of my depression was caused by the vulvodynia. If you can imagine, for 15, and I still suffer with it today, and I'll be 41 in a couple of weeks, so I've been suffering for this all the years, and it's such a horrible thing to live with. So in my early 30s, I spoke to my doctor, and they had mentioned vulvodynia at one of the clinics I was at, and I didn't really know what it is, but it was well explained to me, and they had decided that they were also going to check my cervix. So they did a smear, they did a full internal, they also took biopsies in my cervix. When the test came back, it showed abnormalities. It showed abnormal cancer cells. So basically, I was also having a lot of trouble with my periods. And with my periods, I was just bleeding continuously. I wasn't getting a break from it. And it was so heavy. It was just horrible. I couldn't put up with it any longer, and the pain with cramping as well that I had. So they decided to give me a hysterectomy. I'm glad now that I did have the hysterectomy, because it has solved all the problems that way, really, my periods and stuff, and then especially with the cervix having the abnormal cells. I continued at the same clinic, and I spoke to a couple of counsellors, and I spoke to a couple of specialists in vulvodynia. I couldn't believe that it took to my 30s that I actually get a diagnosis. There was an actual name for it. I wasn't imagining it. It wasn't all in my head. The soreness I was getting down below was... when you get a flare-up, it takes over. And especially I work every day, so it's hard. It's really hard because sometimes even at work I can be in a hell of a lot of pain. But I just need to just try and get on with it. There's nothing else I can do about it. So the doctor explained to me that there wasn't really a cure for vulvodynia. There was only a few things that they could try to see if they would help. So over the years I've managed to get my head around what some of the triggers are for the aggravated flare-ups that I get. So basically I've wrote down a list here what some of the triggers are that can set off a flare for me. So these are basically all the things that I need to try and avoid on a daily basis. And I've kind of over the years I've just learned to deal with it, and it actually doesn't bother me now. So basically the things that I need to avoid is so any kind of sauces, spices, herbs, pepper. I'm not allowed a lot of salt on my food. I can't drink anything at all other than just plain water. Sex is a really big flare for me as well. It can be really painful sometimes. I can't even use like coloured tissue paper either. Like panty liners and stuff, they can set it off. Types of underwear that I buy as well, I need to buy certain underwear, like tight clothing, stuff like that. There's a lot of painkillers that I need to avoid. There's some antibiotics that make it worse. Food with oxalates in it, I need to try and avoid. I'm not allowed too much dairy. When I'm in the bath or shower, I need to get special soap from my doctor. I'm not allowed to use anything at all that's got any scent in it. Two of the main triggers that bring on really bad flare-ups is if I'm really stressed, if I'm feeling really depressed, if I'm really anxious, if I'm really worried about something. I can't sit for long periods, I can't stand for long periods, and I need to be careful with like soap powders and stuff as well. I need to just stick to the one kind, and it needs to be sensitive as well. I also suffer with IBS, and I'll be talking about that in another video. With my IBS, I don't get diarrhea, I get constipation. My constipation can last sometimes a week, so sometimes I'm just going to the toilet once a week, and that can be a really bad flare-up for me. Unprovoked triggers, so I can basically just be sitting 1 minute and then like 5 minutes later I can be doubled up in pain. These just come on themselves. You don't get any warning that they're coming on. It can just happen. So basically, in my sort of mid-30s, whilst I was attending the Vulvodynia clinic, they wanted to start me on different types of medication. So basically just now I'm on a list of medications, and I take them daily. I take them twice a day. There's a couple of them I have to take them 3 times a day. I also have to use ice packs sometimes if I'm having a really bad flare-up. I either sit in the ice pack or I just place it down below, and sometimes the flare-ups, sometimes even the ice packs don't help. That's how bad it can be. I'm also using Stilla gel, which is a anaesthesia gel that I can put inside and outside. The past year, the numbing gel has started to cause flare-ups now for me as well. As soon as I put it on, I just burn completely down below, and it takes over. It's a really debilitating thing to live with, and it is a disease, so and it's getting more and more recognised now, because they've actually got like a Vulvodynia clinic, whereas years ago there wasn't one at all. You always get tested like for your bladder and your kidneys and all that first, and for like infections down below as well. So my flares, I would say I managed to sort of deal with them over the years. like I says, I knew what to avoid and stuff to try and reduce the flares. Doesn't stop me getting flares, but it does help reduce them, especially the medication that I'm on as well. So I would say the past 3 years my vulvodynia has started getting pretty bad again. I do notice a huge difference in myself. My anxieties definitely get worse. Sometimes I get depressed just like everybody. I think everybody in all walks of life suffer from anxiety and depression at some point in their life. Some people just are better at coping with it than others. With the vulvodynia, it takes over you that much that I think it causes anxiety, it causes depression, because it is a really horrible thing to live with. And what makes it worse is a lot of people don't even know that they've got it. There's women out there that can be getting exactly the same things wrong with them over the years that what I got. And like I says, it took me from 15 till I was in my mid-30s before I actually got a diagnosis. So through all the years I was constantly getting the operations, tests, scans, try this, try that, and nothing was helping. If anything, because they were trying me different antibiotics, they say that actually makes the vulvodynia pain 10 times worse. And at that time I didn't know that. I thought that I'll take the antibiotic because it's going to help the pain, but instead of that it was actually aggravating it and making it worse. I was thankful enough. I had quite a long wait. There's a professor, doctor, and as I still call it, the Southern General Hospital. It's the Queen Elizabeth now. So I was lucky enough that there's a guy that specifically deals with cognitive behavioural therapy for vulvodynia patients. I wasn't too sure whether to go and see him at first because I'd already spoke to some different psychologists over the years to try and help me deal with the pain. But as soon as I get sent to this guy, I done a full course with him, and I'm so thankful for him because CBT for me was a hell of a big help. He basically taught me that the way vulvodynia works, it's basically a vicious circle. You actually work yourself up worrying when you're going to have another flare-up, that it can actually bring on another flare-up, and I didn't know this. And it was during the classes that Melody was telling me, I was like, oh my god, you actually understand everything that I've been through. And he explained to me that he sees hundreds of women all with the same thing, or started off with the same kind of problems. Doctors saying try this, try that, nothing was helping. You were going for pass to this one, to this doctor, and you feel as though there's just no stopping this. And you have to live with it. You just need to I've managed with doing CBT, that it's taught me how to train my brain, and the way I explain that is when I have a flare up, I know how to deal with it in my head, and sometimes it can help reduce the pain. It doesn't take it away altogether, but it can definitely help reduce it. What I've found with my vulvodynia is meditation is such a big help for me. I do talk about it a lot to my friends because I'm always telling people you should try meditation. It doesn't really matter what sort of health problem you've got. I think meditation is a great thing. It helps you clear your mind and it helps you to train your brain. It just relaxes your mind, it clears your mind out, and you're able just to relax. And I definitely think it's helped. I've always been a worrier, and I overthink everything. At night when I go to my bed, I hardly sleep. I toss and turn all night because it seems to be at night when you're supposed to be sort of switching yourself off. That's when my mind starts playing. It goes in overdrive, and it keeps me up all night. I definitely say that over the years, I have felt really alone with having vulvodynia, and it actually makes you feel useless as well. Dealing with it is really hard, and it's also really hard for if you've got a partner or a husband. It's really hard for them to cope as well. I'm so thankful that when I did the CBT, the doctor had brought my husband in as well, and he'd also spoke to him about my vulvodynia and like how he feels about it, and how he copes when like I'm having a really bad flare up. But my husband is also, he's sort of taught himself how to deal with it as well. He knows what to say, he knows what to do. So I'm really thankful for that I have got a really understanding and caring husband that, because it's a really hard thing to live with. And a lot of people forget about the partners or about the husbands. They forget that as you're going through a bad flare-up, they're really going through it as well, because they've got to try and they need to know how to deal with it and how to help you when it happens. My doctor had also referred me to the mindfulness wellness, and that's where I've done another course as well on stress and worry. That really helped me as well, because you were in a class with other people that all suffer with anxiety and worry as well. They wanted something to help them as well, and it was really good, because it's amazing the amount of people when you go to a class that you sit and you say to yourself, all these people are suffering for the same thing, well, kind of the same thing that I'm suffering from. And anxiety and that, it's such a big thing, and it's a hard thing to deal with. If you're a worrier, you're a worrier, and I think you're always going to be a worrier. It's just you can do things that can sort of help. It helps you control it. Some days for me can be worse than others, especially if I'm having a really bad flare up. Someone had told me to go into Facebook, and that there was actual Facebook pages that people had set up, and it was for vulvodynia sufferers. And I've spoke to a lot of women on them, and it's just hearing all their stories. It's like just reliving mine over again. What's really sad to see on it is you see the stories about people knowing women that have actually committed suicide, that have been that depressed and anxious about their vulvodynia, that there being no hope, there being no help out there for some people. If you have got a doctor that has never really heard much about vulvodynia, then it can be really hard, because you're going to get moved from pillar to post, you're going to get moved from this doctor to this doctor, you're going to get all sorts of tests done, and it can be really hard. So I'm really thankful for the Facebook pages that people have set up, because it has really helped me. A lot of people that give their advice on it as well, with things that they've been through. I give advice about what I've been through as well, and yeah, I'm really thankful for that. Like I say, I'm not a doctor, I'm not a nurse. I'm only giving my personal experience with it, and I just hope that any woman sitting watching this video, if you're kind of recognising some of the symptoms, then all I advise you to do is go to your doctor, speak to a medical professional about it, and hopefully you will get help for it. Also, one of the really bad triggers for my vulvodynia, it can be chemical pain. So it can basically feel like chemical cystitis. That's one of the main terms that the doctors gave me. Sometimes when I've had a flare up, if I maybe get pain somewhere else in my body, if I've maybe got a headache or that, I need to try my best to avoid taking painkillers, Vulvodynia pain, it's not for me personally, it's not a pain that can be helped through pain relief. Painkillers for me can be a big trigger, so they can be a big no-no for me. So I try and avoid them as much as I can. There is like I said, there is a list of medications that I'm on, and they do help me personally. There's no really much point in me giving the names of them on video because everyone's different. So, and I don't want to give anyone the hope that the medication I'm on is going to help you, because everyone's different. So you're better speaking to a medical professional about it and see what help is out there for you. I just know that it is a disease. It is recognised now. A lot of women, like I says, they probably suffer from it, the symptoms, but they don't actually realise that it could actually be vulvodynia. Like I said, it's such a horrible thing to live with. Just all I can say is don't suffer alone. And I always say, try and speak to your partner, speak to your husband, because like my husband, like I says, he knows exactly when I'm having a flare up. So, and he knows how to deal with it as well, which really helps. It really helps me. So, so that's my sort of life we living with vulvodynia. One of the main things they tell you as well with vulvodynia is do plenty of exercise. So the gym really helps me with my vulvodynia as well, because it helps. The gym for me helps reduce my anxiety. The gym helps with depression. It gives me something to focus on. It gives me an enjoyment for myself as well. The gym is something for me. It's a wee bit of time for me. No everybody is into going to the gym, but it's just one of the things that definitely helps it helps my mind, and the meditation as well. It definitely helps me. And I'm so glad I found that meditating does help, because meditation for me, it gives you that bit of quiet time for yourself, especially when you're working all day or you're coming home, and like there's 6 of us here and we've got like 3 dogs as well, so the house is always there's always noise in my house. So I've basically just got it's like a big cupboard in my daughter's room. It's quite big inside, so I've basically carpeted that, I've painted it, and I've got my candles, and I've just got a couple of cushions. So I'm going to start like meditating more regular as well. I'm going to start doing a meditation in the morning and then one at night. So I'll basically just go in there, close the door, put a wee meditation on my phone, and that's just a bit of relaxed time for me. So I just hope that hearing my story with vulvodynia, it can help somebody out there, because I really don't like the thought of women suffering out there with it, because it is such a debilitating disease that it does take over, and you think there's just no way out. But I really appreciate you sitting and listening to my story with vulvodynia. I do have a few other health problems, but I'm going to be making separate videos. So thank you for listening.